There's a very scientific way to approach lower back pain. If you speak with anyone who treats lower back pain, generally the most challenging part is figuring out what is actually causing it, what's causing lower back pain. And this difficulty is acutely demonstrated by the number of patients who have failed low back surgery, why back pain is a lingering and chronic condition for so many people, and why those who suffer with low back pain or back pain in general typically have to try a multitude of treatments before they find some level of success. And just like anything that can seem mysterious, it can be understood with scientific analysis. And back pain is one condition that can be diagnosed with a high degree of success and accuracy if you apply a scientific approach. To quote one of the most famous detectives in the world, even though it was make-believe, Mr. Sherlock Holmes, he said, "When you have eliminated the impossible, whatever remains, however improbable, must be the truth." So let's start by eliminating the rarest cases first. These are probably things you don't have. Before we discuss the most obvious stuff, let's talk about the rarest. The least common, but generally the most concerning cases. These are ones that are associated with some sort of organic pathology or disease. We've seen these cases in the office that involve cancer or tumors or cysts in the spine and spinal nerves, as well as metastatic cancer that might come from elsewhere or aneurysms from blood vessels. Fortunately, a good skilled clinician can discover these with a thorough exam. You don't have to worry about those in most cases. Another concerning but also very uncommon condition is severe spinal injury. These might be fractures, dislocations, or other type of injury that creates a significant tissue damage. Again, these are typically rare and typically discovered with a good case history and a thorough examination. And most of the time, these types of the cancer, these require interventional medical treatment. But the remaining cases of low back typically respond to some conservative care if a clinician can make an accurate diagnosis and knows how to employ proper treatment. Unfortunately, in over almost 30 years of practice that I've done, I've seen clinicians employing guesswork much more often than actual method of discovery. When it comes to identifying and correcting the root cause of the problem, guesswork just isn't a viable solution. Sometimes a patient will get better for a short time, but then the problem eventually comes back if the root cause isn't found, if the root cause isn't corrected. And in low back pain, when it's not a major pathology, there are generally two primary root causes. And we can break lower back pain down into these two root causes if you look at it scientifically. The first one is a structural problem, and the second one is a functional problem. And I want to start off just by talking about structural problems, because again, these are less common. Examples of a structural problem would be a severe disc injury, a ligament sprain, some degenerative arthritis, or maybe even a genetic malformation. Structural problems can typically be identified because the pain is usually consistent and reproducible. In other words, it tends to happen the same way time after time after time. For instance, every time you bend a certain way or every time you do a certain activity, the pain comes on in the same way. Even though the intensity might vary a little bit, the location would be the same, the quality would be the same, and structural pain is usually defined by its location. There's usually a specific spot where it hurts or a specific area that's affected. These tend to also be less common. Structural problems tend to be less common. Much more common than pathology. Pathology is maybe 1%, but structural pain from a defined source is still relatively uncommon, making only about 10 to 15% of all lower back cases. Functional problems are the most common. And this is really where the rest of back pain cases are. They're referred to as non-specific back pain, and they tend to be functional in nature. And these cases typically present with variable pain, variable frequency, variable location. Sometimes it's in a small area, but then other times it's radiating across a big area. Sometimes it's the left side, sometimes the right side, sometimes it's both sides. Sometimes it might go down the leg, and sometimes it's just in the buttocks. Also, it can be variable in timing. Some days or weeks it might hurt, and then other days or weeks you might have no problem at all. Sometimes only after prolonged sitting it'll hurt, but after a long walk, but then short sitting, not so. So it's variable in the way it presents. And these non-specific low back cases are typically functional in nature because they're associated with a dysfunction somewhere in your movement chain, in the body's kinetic chain. And what this means is that somewhere along the movement pattern of your body, between your feet and your head, there's a joint or structural zone or muscle or system of movement pattern that's not working the way that it was built. And this will typically cause compensation somewhere else. And this compensation system will oftentimes overwork the lower back. Because you present to a doctor with low back pain, most of the time the doctor just looks at the lower back. But imagine if you went to a doctor with lower back pain because you were limping, maybe you had an injury in the foot or an injury in the toe, and you were limping every time you stepped because the toe hurt. And every time you took a step, that lower back had to compensate a little bit for the painful foot. If you did this, you were walking an average day, let's say 3, 4, 5,000 steps a day, that might be 150, 200,000 times a month. Your body has to compensate for this foot pain. This is a type of functional lower back pain. There's dysfunction somewhere else. Sometimes the causative factor isn't as obvious. There might be a neck, rib, or shoulder movement restriction that causes an abnormal posture when you're sitting, standing, or walking. There might be a tight hip or a tight knee that creates a lower back compensation. Or sometimes we'll even see an imbalance in the muscular chain or restriction in movement pattern of some of the vertebrae in the lower back or in the pelvis or in the mid back. These are all very common causes for lower back pain. And they're all very treatable, right? The bottom line is this. Up to 80% of all lower back pain complaints have some sort of functional or compensatory component as their primary causative factor. And unless you're working with someone who has the ability and the experience to examine the whole body, the entire body, you generally run the risk of never discovering the root cause, and the suffering of long-term unresolved low back pain will continue on and on. If we just use a statistical analysis, the chances are 80% that your lower back pain has some functional or compensatory component. In my experience, pills and shots don't fix compensation. If you're lucky enough to work with a chiropractor or a therapist who specializes in finding root cause and functional movement disorder, you're going to have the best chance at getting a resolution for your lower back pain. And as we know, 80% of the time, it's a functional problem. So 80% of the time, you're better off with consulting with a chiropractor first.